that's worked. I can see we're live on YouTube.
Perfect. Okay, guys, let's go on. All right, guys, thanks for coming today. So we're going to talk a little bit about injury prevention in hockey. So I'm going to try and keep it a little bit short and sharp. Okay, we're not going to be able to cover every single thing. So I'm just going to try and make it as specific as possible for our sport, of course. Okay, so today's kind of content is going to go around, talk a little bit about the background of injuries in hockey, some of the causes of the injuries. Then we'll give you some exercises or kind of exercise kind of advice. We'll have a little bit of a discussion about Pilates and yoga and see if they can be useful. And then we'll talk a little bit about the warm up and the cool down, and a little bit about the misconceptions about certain injuries. Okay. So basically, the majority of injuries in hockey tend to be getting hit by the ball or the stick. Okay, but that's not really what we're going to focus on today. We're generally going to focus on what they call these intrinsic injuries, which tends to be like your muscle tears and your ligament sprains. Or you've got like cartilage tears, like your meniscus injuries, and then these overuse injuries. The kind of intrinsic kind of muscle tear ones tend to take about 20% of all hockey injuries, and overuse injuries, 32% for female athletes and 18% for male. Generally, these overuse injuries tend to occur because of repeated stress and our body's inability to kind of heal itself. So some of the injuries, the intrinsic injuries that we kind of see, it tends to be the kind of muscle strains, the commonly ones, the hamstring, the kind of famous one, the groin and the quad, and a lot of the time the calf as well. With the ligament strains, we tend to see a lot of ankle sprains, okay, when you've turned your ankle. And then also you get knee sprains, your ACLs, which is the famous one, and sometimes what we call your MCL and your LCL, which is the outside and the inside of the knee. Another famous injury tends to be the meniscus tear. Again, they all sound very scary and stuff, but they tend to majority of the time be quite treatable. And then your overuse injuries tend to be stuff like your tendinitises, your Achilles, your patellas, and then your mechanical injuries like your runner's knee, iliotibial band pain, which is again another famous one, shin splints, stress fractures on occasions, and of course lower back pain. Okay, so let's talk a little about the causes of injury. So a lot of the time it's either trauma. So trauma tends to be either like a twisting motion, okay, where like, for example, the knee getting stuck in the mud and we kind of turn sharply, and that's where we get those sprains to those ligaments or those kind of cartilage tears. Or we twist and we fall over our ankle like so, okay. Other things obviously is falling or impact from the ball itself. Or someone trying to make a tackle into us and they kind of fall into us and we're going to get caught in a funny position. But the one that I really want to focus on today, and it's really kind of important for us, and I feel we don't, as kind of recreational sports, we don't really focus on very much, okay, is changes in load. Okay, so load itself is the amount of physical stress that you're putting through the body. Okay, it tends to become in a variety of things, which I'll go over in a sec. And generally, the reason why a lot of the time we get these injuries is because of an increase in load or just a decrease entirely of load, okay? So let's give an example of these changes. So we've got Mrs. Broccoli, who's a 26-year-old hockey player, regularly plays in the second team, 2 sessions a week, 1 training, 1 match, plays 3/4 of a game generally, okay? But goes on holiday for 2 weeks, didn't get the chance to train, okay, and then comes back and gets promoted into the first team, plays a full game, and then starts getting some hip pain that she normally has in the past. So if we look at the changes of load and what could have happened there. So first of all, went on holiday for 2 weeks, okay, wasn't able to train, so and then and played a full game, and then also went up into the first team. Okay, so again, you had a bit of a change in levels, a changes in speed. Again, that kind of thing is also part of load. So let's give you some examples. So I'd say a different workout. You might have changed an exercise class, for example. You might have decided to do a HIIT class instead of your regular kind of Pilates or yoga. Changes in position. So for example, if we're playing hockey, you could be playing forward most of the time, but then all of a sudden you get picked to go in the midfield, and then the dynamic completely changes. It goes from a stop-start kind of sprint and start to you're running around a lot more. Okay. Changes in footwear is a big one. A lot of the time I see this around marathon season time. Again, because we haven't really got adapted to the shoe, what happens is that we don't wear it in enough, and then that can cause mechanical stress for the body. So if you do get some new footwear, wear it in. Really important, because it can save you a lot of kind of hassle going forward. We already mentioned different exercise classes. Coming back from a break is another big one. Okay, I see this a lot of the time in teams, is that we go on holiday or we come back from an injury, but we don't try and work our way back into kind of cardiovascularly, also strength-wise. Okay, so we're kind of on a deficit, and then we just go back into what we normally do. Okay, so it's that change in load of the negative, but then we don't actually kind of progress our way back up again. Another thing that I forgot is also changing teams. Okay, yes, we have the ones going up, but also coming down as well. Because if you go down a team, you might actually be working harder because you might be, say, a better player in the team. And again, that can put more different types of loads through the body that your body's not used to. So generally, a good kind of scale is if you're working to 5% changes each week incrementally, you reduce your risk by less than 10%. However, if you increase it by 15%, the load that you put through your body, you increase it by far much more, than 20 to 50%. Okay, so make sure you kind of record it. So the best way to kind of improve your body's tolerance and kind of prevent yourself from getting kind of injured going forward is consistency. It's not an instant fix, unfortunately. Okay, you want a gradual increase in the kind of intensity of your exercise. You don't want to be seeing this, okay, because otherwise you're going to overwork and you're going to get those injuries. Okay, it's good to vary your exercises. Okay, so if you kind of get stuck during normal, like, so for example, bodybuilders get really kind of, you know, immobile and stuff like that, and they're not very good for certain types of sports. So it's good to vary your exercises, okay, to kind of give your body more adaptability, so kind of to hack into the game, basically. And it's going to be good to monitor your performance, which we're going to discuss in the next slide, and understand if you do have an injury, understand your injury, okay? Understand when it might become painful, what might bring it on, for example. There's some studies going in, like kind of the Premier League. Went to a talk with one of the Manchester United physios, and basically sometimes they discuss that they will record the player running, and they will record their distance and how much they run over a certain period of time, and they're inevitably kind of waiting for the injury to occur. So sometimes if the injury occurs and you have this preset data, then you can also learn from your own mistakes in a way. Okay, so when you can prevent and when you need a rest. So how to record your performances? Again, obviously we've got apps and we've got the new smart watches, and so we can keep track of these things a lot better these days. And obviously we've got the old pen and paper, which is really good. Okay, so number of sessions a week is always a good thing. Speed of running or the intensity, you can be looking at the heart rate, the calories burned, and your own perception. Personally speaking, I like kind of working at a 6 out of 10, and then obviously in the match day, then you can kind of really push it hard. But the reason why I like the 6 out of 10, because it means that the next day I'm not going to feel too sore. I'm going to be still feeling good, and I'm going to be able to do it more consistently. Okay, and if I'm working like 9 out of 10 the whole time, then I'm just going to keep getting sore, and then I'm not going to want to do the next day, and I'm not going to get that consistency. And obviously, if you're lifting weights or you're doing certain exercises, sets, reps, times, and rest. Okay, honestly, recording, because then you can actually see the growth. Really, really important, guys. So why is strength and conditioning so important? Well, it basically makes your body more kind of efficient and kind of deal with different kinds of loads. As you get the improved performance, you get better recovery, and you get this kind of reduction in kind of muscle imbalances if you kind of train correctly or kind of work on those imbalances. Improve stability. So stability is really kind of important when you're kind of dealing with the kind of trauma type exercises, especially because it can help if you improve the stability around the knee. It can really kind of help you avoid those kind of sprains. And then improve actually for recoveries from injuries that you've already sustained as well. So the stronger that you are, the better recovery that you'll actually have. So let's talk about strength training itself. Okay, so I'm not expecting you to go into the gym and, you know, pumping weights to look like Arnold. No, what I'm trying to say is that you've got to try and be a bit more specific. Okay, we're trying to play hockey here, so let's do some hockey type exercises. Okay, so lunging, squats, single leg squats. You can put a little bit of the upper body in. I quite like the sled exercise. Okay, obviously these are just examples. You guys might be at a different level, so I wouldn't necessarily just take this for granted and start this straight away. And also train for the positions that you play in, for example. So make it specific to you. If you're a forward, make sure your workouts are short, sharp, for example. If you're a midfielder, you might want a little bit more endurance, a little bit longer. Big thing that we kind of really don't focus a lot on is kind of sprints and plyometrics. Plyometrics and sprints tend to be the thing that kind of closely mimic our sport as much as possible. Generally, they give us that more responsiveness. However, we just don't train it consistently enough. We kind of do a fitness session, we kind of and it's like we do it 1 week, we won't do it the next week. And the problem is the body doesn't get that adaptability, and that's where the injuries can occur. But if you build it into your program a little bit over time, then you can start to see the benefits from it. And then you'll actually see the improvements in performance. Also, though, with sprints and plyometrics, so they tend to be the ones that can cause the highest injury rate, okay, because they put the most load through the body, okay. So again, they should be with real caution, plenty of rest, okay, and the form needs to be good, okay. Form starts to drop, then you obviously increase the chance of injury completely. Generally, bad form tends to mean that you're putting too much load through, and that means that any exercise, okay. So stop, leave the ego at home, and have a rest, get back onto it. The other thing is, a lot of the time we kind of under train, and generally I like to use my sets around 45 seconds to 60 seconds, because that tends to be where the muscle kind of gives the best kind of growth and strength kind of gains. And like generally I'd say about 3 seconds up, 3 seconds down, because you're working both on control and strength there. And conveniently, that makes 10 repetitions. So you can see a good, start with that 3 sets of 10. So to stretch or not to stretch. Now, as athletes, we tend to have a big obsession with stretching because we feel like we're tight all the time. A lot of the time, this is a little bit of a misconception. Actually, sometimes tightness can be somewhere else is causing the issue, or the muscle actually might be weak. Now, obviously, again, we've got to be specific to our sport. So if you're a goalkeeper and you're getting into these positions, just kind of stop yourself from kind of getting these overstretched injuries, which are actually quite a lot harder to rehabilitate than your regular kind of muscle strains. You need to kind of train in those ways. Okay, so I wouldn't say stretching, because stretching, you're not actually working on the control in that range. Okay, you're kind of just stretching into it. You have more flexibility, but it doesn't mean you have the strength at that range. Okay, so it's like, so what we need to work on is those exercises that go into it and then come back. Okay, yeah, you may only be at like 45 degrees at first, but with a little bit of time, a little bit of progression, and you get yourself into that 90 degrees. Okay, and again, make it specific to your sport. So for example, these 2 exercises will be a great one for the goalkeepers. Now, balance and stability, again, they're boring exercises, unfortunately, and we really miss out on them, but they are really, really important, okay? They will help strengthen our ligaments, tendons, and muscles, okay? They will also help relax our overactive muscles. So if you do generally feel tight, it might be because some of these muscles are overworking. and the little tiny ones are not engaging enough. And this is where the balancing exercises come in, and this is when they're really kind of at their best. So you don't have to be necessarily on a BOSU ball. Doing single leg exercises like the lunge and the kind of single leg deadlift over here, you're going to be working those little ankle muscles. You're going to be working on your balance, working on your stability, and you're going to get, say, for example, with this exercise here, you're getting all three. You're getting strength, you're getting flexibility or mobility, sorry, and you're getting and stability. Okay, so something definitely I would add into the program, maybe at the start, just to get a great way to warm up, get those muscles, those little muscles firing, and then off you go. So let's just talk about some muscles not to ignore, okay? So it's the calf muscles, really, really important, especially as if we're keen runners, because the calf muscle, particularly what we call the soleus, which is this deep muscle around here, is the most active muscle throughout all the running at any speed, probably apart from sprinting, okay? But it's a muscle, or those calf muscles, we never train them, okay? Yes, they're a little bit boring, but really, if we have strong calves, we'll be so much stronger at running. We'll have a lot better kind of propulsion as well. Something definitely to look into. Our quadriceps, generally a lot of the time, if they're weak, you can get a lot of knee pains according to them, all right? And again, the foot and ankle muscles, generally we train them when we're doing a kind of stability type stuff. These, if they're weak, can cause knee pains, hip pains, back pains, of course, and foot and ankle pains. And then your hamstrings, the famous kind of muscle tear right here. A lot of the time, again, we want to stretch it, but in actual fact, a lot of the time we need to strengthen it, okay? Strengthen it and also do those lengthening type exercises into it to improve its flexibility or mobility, but also we need to strengthen it as well, okay? Because a lot of the time it's weak, especially if you've had kind of numerous amounts of tears, especially with the hamstring. If it tears once, it's a little bit weaker, if not rehabbed properly, and then those tears can come more frequently on. So again, here's some examples of what you can be doing, of some exercises kind of for the foot and ankle over here, the little wobble cushion, your calf raises, kind of the slant board, kind of squat is good for the kind of quad muscles. And then for the hamstrings, a kind of hilted bridge with your heels up or heels down is very good for kind of isolating those hamstrings. So if you kind of do suffer from any of these sort of injuries over here, so for example, with the calf muscle, if you strengthen that, it could help with some tendonitis, or if Achilles, maybe some calf strains, and maybe some plantar fasciitis, which is where the bottom of the foot becomes quite painful because the connective tissue has had some slight tears in it. Again, quite common one. And then you've got the kind of foot and ankle muscles. If you strengthen those, it can help prevent ankle sprains, knee sprains, again, Achilles issues, calf strains, and that plantar fasciitis. If you strengthen the hamstrings, of course, you will improve on those hamstring tears. And then with the quadriceps, you can improve on those kind of patellar tendinitises, those front of knee pains, and the kind of classic ITB issue. But my favorite muscles are the core muscles and the glute muscles, all right? And if you're going to do anything, personally, I would do these. Okay, these are your foundation, all right? It's basically, if these are weak, it's like kind of having a cannon on a canoe, is how I like to say it. If they're weak, then all your limbs are not going to be as stable. So if you keep this nice and strong, this could help prevent a lot of injuries going forward, okay? Now, a lot of the time, the big misconception with core muscles is it tends to be the six-pack muscles, and a lot of the time, this is not actually the case. It's these deep tummy muscles called the transverse abdominis, the multifidus, and a lot of the time, we don't actually activate them very, very well, okay? Pilates is a good way of, going to Pilates class is a good way of learning to activate those. It's definitely something you should look into. Now, for my favorite muscles, the glutes, very forgotten. A lot of the time they become quite inhibited because we sit down all day. So a lot of the time they're under stretch all the time, so they don't really kind of engage. And things like the hamstrings and the quads, particularly in hockey players, tend to overwork because we're always in that squatted position. But guys, if you strengthen these muscles and you learn how to strengthen these muscles, then it can really kind of pay dividends later. All right, so you're not going to, it will help you with the kind of, especially with the ITB issues, knee pains, It's even kind of shown to contribute if they're weak to ankle, Achilles issues. So really important, guys. Definitely look something up on those, okay? Okay, we've just gone through that. So Pilates versus yoga. All right, so I have a slight bias here because I'm a Pilates instructor, but both have their place. Yoga tends to focus a little bit more on flexibility, while Pilates tends to focus a little bit more on kind of strength itself. But both are very good because they focus on control. I would say, you know, one's not really superior to the other. They both have their principles. I would say for kind of hockey wise, because it kind of does target a little bit more of the glutes or waking up these glutes and core muscles, I'd say go for the, I would go for Pilates. But if you do yoga, it's still a great form of exercise. If you want to get into either one of them, by all means, go for it. But again, start at level 1. Do not start at level 5 because that is when injuries occur, okay? Even with these kind of exercises, I see a lot of the time in my clinic, people, for example, in yoga, bending too far forward, they don't have that mobility in the back, and then they end up injuring themselves, okay? So again, start at the basics, okay? Learn it, learn how to activate those muscles, get the form perfect, and then move on, okay? So let's talk about a little bit about warm-ups. So generally, we do the kind of right warm-ups when obviously over the years. So doing the dynamic stretches, we start off with a little bit of low intensity run. We go into our dynamic stretches. We may do some game activities, but then again, we want to do some plyometric stuff, some shuttle work. Okay, if you're not warm, okay, and if you don't feel like all your muscles are kind of pumped and ready to go, then you've not warmed up properly. Okay, so sometimes the intensity of the warm-up needs to come out a little bit higher. Okay, static stretches, however, static stretches, I know some people love doing static stretches beforehand, but sometimes static stretches have actually shown to kind of inhibit a muscle before a performance. So it can actually reduce your performance. I wouldn't say it necessarily increases your risk of injury, but your muscle output might be down. A good warm-up will, if you are injured, okay, or you are kind of got a little bit of injury, will help you through, okay, and stop you kind of maladapting or kind of compensating for that injury through the game. Things that you can do is sports taping and knee braces and ankle braces, especially if you've got an injury or you feel like there's a little bit of a stability issue around one of those joints, okay? So by all means, go for it. So cool down and recovery, okay? Now this is really, really important, okay? So the recovery can really kind of help us because it can keep our consistency going, okay? If you recover well and we get rid of those DOMs, it means we can keep going throughout the week, okay? If you're sitting there and you've got DOMs 3 or 4 days later, then there might be a slight chance that you've overtrained a little bit, okay? So with an active cool down, you want to be doing a light version of the things that you've been doing in the game, maybe some running, maybe some lunging, maybe even some dynamic stretches. Then your passive cool down, you want to be doing statics. I'd say the thing is, the whole point is about taking that heart rate down. And it's also, you want to help with your breathing as well, and of course sort of the mind as well, because a lot of the time we're feeling very angsty. But with the stretches, especially the passive stretches, you don't want to be stretching at 8 out of 10 because you've already had breakdown in the tissue. Okay, so we don't want to break it down. We don't want to be stretching it, okay, because that could cause a little bit of inflammation. We want light stretches to promote some blood flow there, okay, just to start that healing process to flush out any of those lactic acids. Now, especially if you're kind of playing 2 games, one after the other, it's quite good. You could do some foam rolling or wear some compression gear. Both of them kind of help kind of promote blood to the area, but which can help kind of reduce your kind of lactic acid and kind of make you feel good. I wouldn't use it necessarily for an injury prevention type thing, but it's very good at kind of helping you recover. Nutrition is not really my forte, okay, and it's not really my field of expertise. So, I mean, we know what's good and we know what's bad. I'll kind of leave it at that. Hot and cold therapies have shown again to kind of help speed up the recovery rate, and also particularly cold therapy tends to be a little bit more advantage because it can help reduce any kind of inflammation that might have been built up through stress through the game. But the biggest and most important one is sleep. Okay, sleep is incredibly important. Okay, our muscles only really recover and rebuild and get stronger when we sleep. Okay, so if you've done a really big workout and you're feeling great, and then you have a bender until about 4 o'clock, you're really not going to get those benefits, but you're going to feel sore the next day. So, but like, for example, a lot of top athletes these days kind of really promote sleep. Mr. Roger Federer over here, he says he sleeps for 12 hours a day. He's 38 and he's still playing at a very, very high level. So pretty much believe him on that one. So misconceptions. So the first misconception is my posture is the reason why I'm injured. There is no kind of research that suggests that posture does cause pain. I'm not saying that, like having bad posture, you can have bad posture now and you'll be pain-free. If you're sitting at your desk and you're kind of hunched over and you're there for about a couple of hours, it may not be painful for half an hour, it may not be painful for 2 hours, but eventually it may become painful. If you put your tissues at end range, say for example my finger, if I put it in this position for a period of time, it's not painful now, but give it a little while and it becomes painful. And that's the same sort of thing when it comes to posture. So if you're sitting at your desks and you feel like you're in bad posture, stand up. It's recommended to stand up every half an hour. Maybe just do tiny little bit of exercise or go for a walk around the office. It can make a big, big difference. My scans show me something is wrong. Now, a lot of the time when we have a scan, it may show something up that you have a meniscus tear or a cartilage tear. Now, that could be the reason why we're in pain. A lot of the time, these scans can be quite misleading and kind of cause a lot of anxiousness with us. So don't always take the scan as gospel. It's just a picture. Majority of the time, everyone has these kind of things. If they scanned me, I'd probably shown to have, cartilage tears all over the place. Okay, but I'm not in any pain. Okay, if you keep yourself strong, okay, and you don't, again, you progressively work upwards, you should be fine. Running, I'm not allowed to train or play with pain. Okay, so this is a bit of a tricky one. If you have an injury, okay, depending on the injury, you can play with a little bit of pain, particularly with some knee injuries. If you got 1 to 2 out of 10 pain, you are okay. But if you're getting into those 4, 5s, and 6s, then you need to kind of back off a little bit. Okay, it depends on how irritable it is. If you feel like you can make it through a game, then you should be okay. Lots of running causes injury. Now, running doesn't cause injury. The only reason why running would cause injury, again, is if you didn't progressively load. Say, for example, you've got used to doing 5K 3 times a week, and then all of a sudden you decide to, do 5K 5 times a week. Okay, you've overshot that 15% and you increase that chance nearly to 40, 50%. Okay, lifting heavy weights causes injury. Now, again, yes, it can do, but it's all about what your body can tolerate. Okay, you take it step by step, and eventually you'll be able to lift heavier weights. A heavy weight really is something that you're able to do around 10 times in a controlled manner for about 3 sets of 10. Okay, if you're doing 20 repetitions of it, then it's not heavy enough. And we've already gone through the tight feeling of muscles. Okay, so I think that is it, guys. So if you've got any kind of questions for me, that would be cool. Just unmute yourself and then just go for it. Or you can put something in the comment.
Yeah, or chuck a hand up maybe as well. Put a comment in or put a hand up. Quick one, Karl. Just on changing footwear, how do you suggest wearing them in?
I just walk in around in them. It's fine, and then start to progressively have some runs with them, just like in your kind of normal distance. Nice and simple. I'd say about 2 weeks.
Cool.
Anyone else?
And me, I've got one. I think a few of us in the twos, our first session back, we got like a strained glute, or as I like to call it, slapper's ass. So how would you suggest kind of, I don't know, sorting that or improving that?
Okay, so it's a difficult one to say because obviously I haven't assessed you, but there's one of two things. One, you might not be mobile enough to get into that position. So you might need to do probably a few actually going into that kind of slapping position and just work it through. Other things, generally while we get kind of tight hip muscles, is probably a weakness in the bum muscles. So I would say strengthen up the glutes. Again, I can't obviously go through those exercises right now, but I definitely would look into strengthening up those bum muscles.
Thank you.
I have a question. What is, like, especially around hockey training, what is a recommended exercise versus rest ratio, I guess, like the day after?
And sorry, of the day of hockey, sorry.
No, absolutely not. No, the day after, like you could hypothetically wake up at 7 and go for a run, or should you wait like a day and a half in between?
It depends personally. It depends what you're used to, and it depends on how hard you worked in the game, and it depends on how stiff you're feeling the day after. There's no reason why you can't go for a run. I would probably just take it back a little bit, again, because if you've hit like 9 and 10 out of, you've already put your lot through your body. Okay, so you're probably looking. I would probably just shorten the distance ever so slightly, or just reduce the intensity. Because actually a run sometimes after a game or the day after a game is quite good, just to help out, flush out that lactic acid and kind of reduce that kind of stiffness. So there's nothing wrong with it. And again, keep that consistency. So if you want to make that a daily, like a weekly habit, just again, record what you did on that Sunday and then record what you did the next Sunday and just slowly progress it upwards, if that makes sense.
Cool, thank you.
Carl, I've sort of like, obviously going back to hockey, after having a long period out, I find that my calves and ankles are getting quite sore and tight. So like, I know you said that sort of static stretches isn't necessarily good before a game, but would you advise keep doing static stretches every night, or would you advise more do exercises to sort of loosen them up?
I would say personally, so I would do some exercises in general. So I would do the stability ones, okay? I would do some general, probably some calf strengthening, okay, and working on the actual calf length. So going up onto your toes and then coming down onto the step into the stretch. So then you get the best of both worlds. You get that kind of slight static stretch, but then also you're lengthening that calf muscle as well, which will help reduce the tightness. But also doing a lot of balance work. So if you're finding that your ankle is getting stiff, then it generally means that there's probably a little bit of weakness around the ankle joint itself. So that's why you got to kind of strengthen up that ankle joint. But yeah, I would always say go on the strength side.
Yeah, makes sense.
I have a question. You know, on those weeks where it feels like you've got just so many hockey sessions, it's difficult to fit in a lot of other strength and conditioning or runs or sprints. If you have like 2 matches and 2 training sessions, what would you say would be your top pick for the additional 1 session you might have time for? Because it feels like there's a lot to fit in.
Yeah, I know, totally get that. All right, I would personally, if you're going to do anything, you might have to do your own little bit of research, but I would always do a little bit of core work and a little bit of glute work, okay? Because they're your foundation. Even if you just pick 2 or 3 exercises, maybe 1 core exercise, 1 glute exercise, and 1 maybe stability exercise, yeah, and then repeat that 3 times a, 3 times a week, once a week, and then going forward. And then obviously make the exercises a little bit more difficult as you go on, then that should be sufficient.
Great, thanks.
I've got a question. Just on cooling down, If you were going to say foam roll after a match or a training session, is there a specific amount of time that you need to do it in, or does it not matter?
Generally for foam rolling, it tends to be that you got to do it for about 90 seconds to kind of see that, so you see that benefit. But the only thing about foam rolling, which I forgot to mention, is just don't go too aggressively with it, especially if you've got a game the day after, because you don't want to cause any kind of bruising, or you just want to literally just want to kind of mobilize the tissue and promote a little bit of blood flow there. But yeah, 90 seconds tends to be per area, tends to be quite good.
Okay, and then in terms of actually doing the foam rolling, is there a difference between if we do it straight away after a match or say 3 hours later?
That doesn't particularly matter.
Doesn't matter.
Okay.
Okay.
It doesn't particularly matter at all.
Okay, thank you.
Carl, so I actually had the exact same question as Kerry, but with a follow-up related to yoga as well and stretching. I find that sometimes I do a HIIT session and then immediately I go into a yoga session. And I know you mentioned you don't want to double tear, but I feel fantastic, right? So what's your recommendation on how much time to wait in between?
I mean, like, the thing is that if you're used to doing that, then go, by all means, keep going with it, if that makes sense. If that's part of your thing, keep going with it. There's nothing wrong with doing those. Like I said, I've got no problems with yoga. Like, I mean, if your body's used to it, by all means, go for it. Okay, there's nothing particularly wrong with that.
Cool, thanks.
Is Jonathan still here? Jonathan's asked a question, but Carl, any suggestion?
He said
Hey
he's
Carl, yeah, I'm around. Sorry, just a bit of background noise.
What's so hang on, what is your question?
I was just wondering, so for some of us who perhaps haven't done as much training as they would have liked to in the lead up to the hockey season, any recommendations on kind of, or suggestions on trying to, get fit quickly? Obviously, most of your thing was about consistency and building up over time, which I don't necessarily have the luxury of.
Okay. So how much time do you have?
Now until the start of the season, I guess.
And as in, like, how much time do you have a week, for example?
Oh, sure. So I could probably do like maybe three sessions a week.
Do you generally have a program that you normally do?
I'd like to say yes, but I've been very inconsistent.
Okay, so then just what, and have you been doing it recently?
Yeah.
Fine. So what I would probably say then is start up with your plan again, and then try and increase the consistency of it. Then start to add some of these strengthening type exercises. And then what you want to do is kind of try and time it so you can get to some sprint work and some plyometric work by the end of it. Okay, because that's going to give you, if you can do those exercises and you feel fine afterwards, okay, then that's going to give you the best opportunity to making sure that you're okay for the season itself. I think it's 4 weeks away. Actually, no, probably less than that, about 3 weeks away now. It's definitely a difficult one, but like I said, I'd say try and do your regular routine and try and implement some exercises to strengthen the legs up. And then if you can add some sprints in, some plyometrics in gradually.
Perfect, thanks.
Anyone else?
Carl, sorry, what's a plyometric? Like, what does that mean?
Oh, so sorry, guys. It's like a jumping type exercise. Like when your squat jumps and your skaters and things like that.
So like anything high impact.
Yeah, high impact. You like little shuttle runs. Ladders can also be kind of considered as plyometrics. But yeah, they're the most kind of sport specific stuff, if that makes sense.
Thanks.
Anyone else?
Carl, you mentioned core being, or your core being forgotten muscles. What's your go-to core workout?
My go-to core workout. I would probably say, if I'm just going to work on the core itself, I probably warm up with a little bit of the exercise called a bird dog. Okay, if you search it, you'll find it. I may do some plank work itself. Okay, and again, I may vary the levels of what kind of plank work I do. I definitely will do some side plank stuff. Of course, I'll also add in some glute exercises, kind of to kind of like clam work. And then I would probably do some exercises where I'm on my back and I'm trying to control my pelvis. So I'm trying to keep the back relatively flat and then moving my legs and arms in a controlled manner. Okay, and so not less kind of sit-ups and crunches, kind of more controlled kind of work. So kind of, and that's kind of true core, if that makes sense.
Sounds great. Thanks.
No worries.
I've got another question. So the night before a game, is there kind of anything in particular that we should be doing to kind of help our bodies prepare for the game or anything?
I would say make sure you eat right. Make sure you don't have anything too, I would probably reduce the amount of alcohol. Fatty foods are probably a no-go. Salty foods as well. Maybe something relatively carby, and make sure you get your sleep right. You could do a little bit of foam roller work. You could do a little bit of light exercises just to keep the muscles warm. But apart from that, just make sure you get a good night's rest, get your food right, and probably limit the amount of alcohol.
Great, thank you.
Can I just ask why salty foods? Because I'm definitely guilty of always having that.
It's just because you get a bit dehydrated, if that makes sense.
Right.
So if you sit there and you wake up and your mouth is dry, then you probably had a little bit too much salt. I mean, a little bit of salt is good, but too much it's not so good.
Right.
Karl, what would you recommend in terms of intensity for a good warm-up for the match, in terms of like exercises?
Well,
to get really.
That's a good question. So I would vary it. So you start off with literally like a light exercises, like light jogging, and you're literally looking at like a 2 or a 3. The dynamic stretches should be nice and controlled. So again, you're probably looking at like a 2, 3, or 4. And then you probably want to do some kind of sport specific stuff where you're kind of working around your 6s, your 7s, and you kind of build up into maybe 8s. And then obviously your hockey drills to get your kind of hand-eye in. And then you kind of take it the intensity the coach wants at that point. But you just want a gradual increase. And if you want to kind of hit around a 7 or 8, then you're golden.
So what do you mean with 7 and 8?
Oh, sorry, your own perception or intensity, if that makes sense. So,
okay. Yeah, thanks.
Any others?
What kind of thing do you think I should be doing? Because I mean, I'm still growing, well, sort of. So do you think I should be doing like weights or more Pilates? I'm just a little unsure.
Okay, so what have you done at the moment?
Mainly just sort of running and sit-ups.
Okay, and I would then probably recommend doing maybe not weights, but certain body weight exercises. I would get yourself into kind of lunging exercises with good form. Okay, so it might be worth going to see someone about that so they can kind of edit your form and make sure it's good. I would highly suggest Pilates. I think Pilates is really good because it teaches people about control and more kind of awareness about your own body, and like the way that it kind of works. So personally, yeah, good. Do those 2 things. Maybe weights, you might not want to straight away, but body weight exercises definitely, and then you can kind of progress into those weights.
Okay, great. Thank you.
No worries. Anyone else? No, I think that's it. That's it, guys. No other questions? Are we all good?
Sounds like we're good. Karl, massive thank you for giving up your evening to do this.
No worries,
really
guys.
appreciate it.
Thank you very much for attending and asking the questions. Like if you've got any issues, just ping me an email or WhatsApp or what have you. And have a good night, guys. And take care.
Thank you so much, Karl.
Bye, guys.
Thanks.
Thank
Bye.
you.
Hey.
Bye.